So my name is Catriona Neville. I am a extended scope practitioner therapist, facial therapist, and I specialise in facial palsy and have done so since about 2002. And I work at the Queen Victoria Hospital in East Grinstead. So I'm going to talk to you tonight about what's involved in specialist facial therapy. I'd just like to thank Facial Palsy UK for asking me to do this talk. It's a real pleasure to be able to do it, and also acknowledge all my facial therapy colleagues who have helped me pull things together for this talk tonight. So the first thing I want to talk about, and I hope that I will answer all of your questions throughout the evening, is the importance of the face. Because our face is so important for so many things. Over 50% of our communication is non-verbal, so a lot of that is the expressions that we make with our face. So I would say that facial palsy is partly a communication disorder. But it's also a functional disorder, so it affects you being able to close your eye or speak well. It can affect how you breathe through your nose, it can affect how you can kiss people. So many things can be functionally affected. And also, facial palsy can affect your mood. So if you can't smile, it's actually been proven with research that you can't feel as happy as people who can smile. So facial palsy is absolutely not a cosmetic problem. And we hear quite often people saying, oh, my doctor told me that this was just a cosmetic problem. And it absolutely is not. That's so important. So there's two different types of facial palsy. A facial palsy that's acquired, which is one that can happen suddenly at any point in your life, and that can affect any age, from children all the way up through to adults. So this is when someone whose face has worked normally suddenly stops working on half of the face. It can stop working on both sides, but that's very rare. And there's lots of things that can cause this. The other type is congenital facial palsy. So this is when someone is actually born with a facial palsy. So they never actually have movement in the affected half of their face. And it can be just part of their face, not the whole half of their face that's affected as well. So the treatment would be very different for the two different types of facial palsy. So why do you need to have specialist facial therapy? Why can't you just fix yourself and get better yourself? So for the facial muscles to work well, you need to have enough strength in them. You need to have enough mobility in the tissues of the face for them to move easily. And you need to have really precise coordination between the brain and the facial muscles themselves. The face is really different to the rest of the body. So if you tried to work on the face in the same way that you would work on the body, it just wouldn't work at all. And we'll talk a little bit more about why. So if we take an example of the face and we compare it to something like the upper arm in the body, we can see that the face has got lots and lots and lots of small muscles. In fact, there's 23 muscles roughly on each side of the face. And if we compare that to the same sort of size of the body in the upper arm, there's only two muscles, the biceps and the triceps, in the upper arm. Also in the face, the muscles only have to move the skin, and the skin is very light to move, as if you were just picking up your t-shirt and moving it. Whereas in the body, the muscles have to move the heavy bones around. Also in the face, there's no joints that can limit the movement, so the skin can really move as much as you want it to, whereas in the body, the movement would be limited by joints. Also in the face, the muscles are all interconnected, a little bit like a patchwork quilt, and that's different to the body as well. And these muscles in the face, the 23 muscles on each side of the face, are actually capable of doing over 2,000 expressions. Whereas in the body, the two muscles that you've got are only capable of doing two movements, flexion and extension. So the face, to make all these expressions, needs really precise coordination, whereas the body just needs less coordination. And you can see all the muscles of the face on my diagram here. And there's also muscles that go all around the ear and round to the back of the head as well that aren't shown on that diagram. So it's a very, very busy part of the body. Other differences between the face and the body is that in the face, your movement is linked to your emotion. And that's not the same in your body. So when you're happy, you smile, but when you're happy, you don't suddenly move your arm. It would be very strange if that happened. So a lot of the movement in your face is very unconscious compared to a lot of the movement in your body, which is very deliberate. And the face has very gentle, subtle movements compared to the body, which tends to have more powerful, large movements. So you don't need a lot of strength for the face at all, whereas in the body you do need more strength. So facial movement is almost effortless, whereas body movement is much more effortful. And that's really important to realise, because in the face, if you try and get more strength, it doesn't give you more function. Whereas in the body, we're used to this no pain, no gain, and keep working harder, and more strength can give you more function. So they're absolutely different. So some people will say, why can't I go to a general therapist? And maybe your doctor said to you, oh, I'll refer you to a general therapist. But facial rehabilitation isn't taught at university. So general therapists won't have any specialist expertise in this area. And so unfortunately, they might be more experienced in treating the body, and they might base what they do with the face on what they would do with the body. And we now know that the face is completely different to the body. So if you see a specialist facial therapist, they will have done extra training in the field of facial therapy. So they will understand how to rehabilitate the face specifically, and they will understand that the face is completely different to the body and needs completely different rehabilitation. So when we are going to retrain and work with someone to retrain their face, we follow a model. So we look at retraining coordination, not retraining strength. We look at getting accurate control of the face. So we're not giving out exercises and you've got to do 10 repetitions of this. It's about learning to control those coordinated small movements. So we really look at precision rather than just trying to get as much movement as possible. So we use the analogy that we're trying to make music with the face rather than just make noise. And there's various different stages that you will go through when you have facial palsy, and they all need different management. So in the beginning, when you get your facial palsy, you have flaccid paralysis, so your face is floppy. So pressure, which is usually caused by swelling, squashes the facial nerve, usually around the ear area, and it stops the signals getting through from the brain down the nerve into the facial muscles, which is how the facial muscles would normally work. So it's a little bit like if you stood on a hose pipe, it would stop the water getting through and the water would just stop. So the nerve having pressure on it and being blocked stops the signals getting through and stops the muscles working completely, so they drop. Now, once the pressure is removed, the nerve signals can start to get through again and the face can start to work again. So I just wanted to mention at this point about steroids and antivirals, because it's recommended that steroids are given within 72 hours, or 3 days, of developing facial palsy. And the reason for that is because steroids reduce inflammation or swelling. So in theory, the steroids would get the pressure off the nerve more quickly. However, I think it's really important that I mention that just because you've had steroids early, it doesn't guarantee that you'll recover. I've seen a lot of patients over my career who've had steroids and still haven't recovered well. So I think it's important to know that if you weren't given steroids, and not everyone has been, yes, it's not ideal, but it doesn't mean that you would have recovered had you had them. So I think it's really important to try and let go of any anger about that or any regret, because that can really affect your recovery. Antivirals would only tend to be given in more severe viruses, so something like Ramsay-Hunt syndrome, for example, and there's less evidence that they're beneficial. And another thing to remember is that when you've had a nasty virus like Bell's palsy or Ramsay-Hunt syndrome, it's really common to have post-viral fatigue. We've all heard at the moment about long COVID and people being very fatigued after they've had the COVID virus. So exactly the same thing can happen after a facial palsy, and it's important to remember that and rest and let yourself recover, and it can last quite a long time. So let's talk a little bit about the types of nerve injury that you can have in facial palsy. because different amounts of pressure caused by swelling on that nerve can cause different types of injury. So if there's only a little bit of pressure on the nerve, and this happens in about 70% of all facial palsy cases, then recovery will happen quite quickly, in about 6 to 12 weeks. And these patients won't have any complications and they won't need any specialist treatment. However, if people have more pressure on the nerve, so maybe a more severe virus, more inflammation, more pressure on the nerve, the recovery doesn't even start until about 4 months after the facial palsy. And these people are really likely to get complications, and they're the ones that are definitely going to need specialist treatment. There is a third type of nerve injury, and that's when the nerve is cut or doesn't exist or it's been totally damaged. And these patients won't get recovery without some sort of repair of the nerve or a surgery to try and reconstruct or reanimate the face. And they will definitely need treatment before and after any surgery. So the first thing to think about is what you should do when your face is floppy. So if you imagine the brain and the nerve and the muscle, so the brain is like an electrical socket with providing the power, and the nerve is the electrical cable, and the muscles are all little lamps in the face. So if your lamps are not plugged in at the wall, there's no point trying to turn them on because they definitely won't work. It would be completely pointless. So there's no point trying to exercise at this stage. It would literally be like trying to turn a lamp on and off, on and off, on and off, with it not even being plugged in at the wall. So at this stage, all you've got to do is rest. You've got to protect your eye because that won't close properly. You've got to stretch your eyelid to stop it getting stiff and massage your face to keep your muscles supple. And there's lots of videos to show you exactly what to do at this stage on the Facial Palsy UK website. So for approximately 70% of people, as I said before, the pressure on the nerve will be mild, and they just need to follow this guidance and the nerve will start working again in about 6 to 12 weeks. Nothing else is needed. So the pressure will be removed from the nerve when the swelling goes down and the face will just start working again with no problems. So nothing special is needed for these people. So a lot of people contact me and they say, well, I've heard my friend told me this, or I've read on the internet this. But I would just say to you again, 70% of people will get better without any treatment at all. The problem is that these people will go and try different treatments and they will assume that it was the treatment that made them better, not the fact they just recovered anyway. So then they tell their friends, I had this treatment and it helped my facial palsy. And they put on the internet, I had this treatment and it helped my facial palsy, because they're trying to help other people. But unfortunately, it's untrue that it was the treatment. It was actually natural recovery that cured their facial palsy. So for those 70 people, the treatments they try, unless they're dangerous treatments, probably won't do them any harm. But for the other 30% with a more severe nerve injury, those treatments that they're busily recommending to everyone could actually make their problems worse. I wanted to particularly talk about electrical stimulation because research findings actually don't prove that it's effective in facial palsy. In fact, there is now some research that shows it can interfere with proper nerve healing and can actually reinforce abnormal movement patterns that can happen in a more severe nerve injury. Also, sticking electrical stimulators on your face is not going to help you relearn expression or functional movements. And it's not going to generate any emotional input as well, which we know is so important for the face. And most of the research that's been done on electrical stimulation is done in the body. And we now know that the body is completely different to the face. So I think what's also important is to think that there is a lot of research that supports other types of therapy, like specialist facial therapy, that are also completely risk-free, that don't interfere with nerve healing and that don't reinforce bad movement patterns. So for that reason, I would say you should avoid electrical stimulation. So what happens if it's been 12 weeks and you were hoping to get better, but sadly you're not getting better? So when there's that severe pressure on the nerve and the fibres get damaged and they have to actually regrow. So from where they're injured, the nerve has to grow, and it grows at approximately 1 millimetre a day in a healthy young adult. So as I said to you before, the site of the injury of the nerve is usually near the ear somewhere, and the nerve has got to grow all the way back into the facial muscles. So if you think how slowly it's going to grow and how long that might take, the first recovery tends to be seen at about 4 to 6 months in the cheek area, whereas the longer branches up into the forehead and down into the chin, and you can see the branches in yellow on my diagram here, they take a lot longer to recover, those long branches. And after any nerve injury, you have to relearn how to move. It doesn't just come back automatically. If you had a nerve injury to your legs and you were in a wheelchair, you wouldn't expect to just suddenly stand up and start walking again. And it's the same for your face. It doesn't just come back automatically. You've got to relearn how to use your face or how to walk again with your face. So you're going to need specialist treatment to help you with that. And one note I would say is if you don't make any recovery at all, so there's been no signs of improvement whatsoever by this point, you should really get a specialist assessment just to rule out anything else that might be going on and causing the problem. So as I said, there's different phases of recovery. First of all, the face can be floppy in the early stages. So as you might know, if you've had it yourself, the face drops, the eye gets very dry and won't close. Your mouth can be dry. Your hearing can actually be very acute, so everything sounds really loud in your ear. You might not be able to taste things very well. You won't have any movement in any of the muscles on that side of your face. So your face is not working at this stage. As the nerve starts to recover, you enter a phase called paresis. So this is when a little bit of tone comes back into the muscles, the symmetry might start to improve, but your muscles might be a little bit stiff from having not been used for a while. You'll start to get a little bit of movement, and you won't have any synkinesis at this stage. So your face is working a little bit, but still underworking. And the final phase of recovery for people with a more severe nerve injury is actually called synkinesis. And this is when the muscles get really stiff and tight from overuse, from using the wrong patterns of movement as your face has desperately tried to get moving and recover. And you start to get these abnormal linked movements. So for example, while you're eating, your eye might be closing as you chew. So the face goes from when it's floppy, very much doing less than it would do normally, as it recovers, going back to almost a normal level, and then actually overshooting and starting to overwork. So synkinesis is this point where the face is overworking. So there's two pictures here of two lovely ladies that we've treated, and you can see that actually they look quite similar in the way they're presenting. You know, they've both got the corner of their mouth on the right side going down. So the first lady has got facial palsy on her right side, and she's got a flaccid paralysis, so her face on the right is floppy. The other lady, her facial palsy is actually on the opposite side, and her left side is actually tight, and she's got synkinesis. So they are completely different problems that these people have got going on. But you can imagine, to the untrained eye and to the untrained therapist, it might be difficult to tell those two apart and to know what was actually going on. And so they might be inclined to give the wrong treatment to the wrong patient. And synkinesis is actually often mistaken for weakness. So people don't have a lot of movement because their face is so stiff, so they just assume, oh, it must be still weak. Actually, we know that it's over-recovered, it's overworking. So it's not that it's underworking, it's that it's doing too much. So synkinetic patients very much need to learn to do less with their facial muscles, not more. Really important, it's overworking and they've got to do less. So once people start to see a little bit of movement, what should they do? Well, the first thing they should do is never ever force facial movement. As I said before, it's a very gentle thing. It's very subtle and graceful. You don't want to be trying to put effort into your facial movement. In fact, if you're putting effort in, you're doing it wrong. And you've got to relearn. Well, relearn, you've never really learnt it. You've got to learn about the muscles of facial expression. So when you're born, your face just works and you've never had to really learn what to do with it. But after a nerve injury, you've got to actually learn from scratch all about the muscles. So you need to train your brain where each muscle is, what its address is. So exactly where is the smile muscle? What is the address of that smile muscle? And which way do they pull on the skin? So where does the smile muscle pull to? And what does it do? What's the function? So with the lip muscles, which way do they move? What is their function? What are they there for? And do they work with any other muscles in order to make facial expressions? And it really helps if you pay close attention to the side that's not affected. So you can use that as a template to really think, right, how does that feel when I move? What's happening there? What muscles are all working? Where do I feel it? And then you can try and use that as a model to practice and mimic with your affected side as you're relearning facial movement. And as I've said, having help from someone who's a specialist in this, who's trained in this, and who really knows all the muscles and all the facial expressions is really going to help you. So just to give you a couple of examples of patients who've come to see us in the paresis stage. So this is when the nerve is starting to recover, the muscles are starting to come back online. So this patient I'm going to show you was 4 months after having facial palsy on the left side when she came to see me. And she really said, oh, my nerve hasn't recovered, Trina, and my lower lip is really weak. And so we had a chat and we said, well, maybe the brain and the nerve just can't find the address of that lower lip muscle. And we worked on it and we talked about the anatomy and we trained her. And after 20 minutes together, this was the change in her lip movement. So much better lip movement. So she had relearned the address of that lower lip muscle and her brain had learnt how to find it. So the nerve was there all the time. The muscle was there, it wasn't weak. She just needed to relearn how to get the message from the brain through the nerve and down to the right muscle address. She just needed help and training. This second patient was 5 months after having a left facial palsy when she came to see me. And she said to me, Trina, my lips are really weak. They've never recovered. They're really weak. They're just not working. They haven't recovered. And I thought, I don't think that's true. So again, we did some specialist training with her. We talked about where the lip muscles were, how to find them, what their job was, which direction they move in. And this was the change in her lip movement, her pucker, after 20 minutes working on it. So you can see she relearned the address of the lip muscles and how to find them. And she got a good connection from the brain through the nerve down to the lip muscles. So that was great. So what about synkinetic patients? How can facial therapy help them? The first thing I would say is synkinesis is really, really misunderstood. It's a nerve injury. It's not as simple as a bone. Like if you break your leg, the bone heals and you can just get going again. If you tear a muscle, it heals, you can just get going again. Because facial palsy is a nerve injury, it's a lot more complex to rehabilitate. So movement won't just come back without special retraining. And it's also really important to note that long after the nerve has recovered, you can still get improvement because you can reorganize this muscle activity and slowly retrain the brain in how to coordinate between the brain, nerve and muscles. So when people have reduced movement, it's not weakness. Everyone thinks it's weakness when they come to see me, but it's not weakness. And it's not poor nerve recovery either. It's because their muscles have got very tight from overworking. They are using the wrong muscles to try and do things because they don't understand which ones to use. And they don't have much coordination in the muscles. It's not down to a lack of strength. So people will often say, oh, my mouth is droopy. And actually it's not. it might be pulled down by the neck muscles being really tight, so the mouth isn't droopy at all. So there are more muscles working on the synkinetic side of the face than on the unaffected side. Lots of muscles all working together and blocking each other. So if you've got one muscle trying to move one way and another muscle that moves the other way, when they both work at the same time, they cancel each other out. They block the movement completely. Just think, if the nerve wasn't working, no muscles would work. The face would still be paralysed. So the fact the face is tight means that the nerve has to be working. So I've already said, if you have the wrong sort of therapy, it's just going to make the problem worse. The muscles are not weak, they're overworking. So if you try and strengthen those muscles up and do loads of powerful movement with them, and they're already overworking, they're just going to overwork more and get tighter. So a lot of people say, oh, I tried therapy and it didn't work, and therefore I'm going to be stuck with this forever. And they're really distressed about that. And I would just say to them, if you didn't have specialist therapy, then that's probably why it didn't work. So like I said, it's the opposite to other types of therapy. And if you try and increase the strength, it will not improve the movement. In fact, it will usually make the movement worse. So you've really got to get specialist guided therapy to improve your movement. So the first thing I would do treating synkinesis is I would deal with the muscle tightness and the stiffness, because if you think about a muscle that's in a cramp, it can't move properly. If you've ever been for a run one day and then woken up the next day with really stiff, tight legs, you'll know that you can't move gracefully and gently around the house when your legs are really tight and stiff. It's very difficult. Your movement's quite jerky. So tight, stiff muscles can't move subtly and gracefully and gently. So we've got to get rid of that tightness and stiffness first. It's going to limit your movement. It's going to increase the effort you need to move and give you pain as well in the face and cramps and spasms. So we would use soft tissue mobilization, trigger point releases, stretching and massage and heat. They would all be techniques that we would use to treat synkinesis. So does stretching make a difference? Is it worthwhile? Is it worth bothering with? Well, this gentleman I'm going to show you had facial palsy for 11 years before he came to see me for his therapy, for his synkinesis. And you can see in this picture that when he puckered his lips, his left eye was closing and getting tight. And actually the whole of the left side of his face was quite tight. So I saw him in session 1 and I just gave him stretches to do, and he went away for a number of weeks, about 8 weeks I believe, and he just did stretches for his face, no other treatment at all. And this was how he looked when he came back. So you can see his whole face is more relaxed, his eye is more open, and his lips are coming centrally much more, and he also had no pain in his face when he came back. He was able to eat and drink and speak more easily, and his face was just much more comfortable. So yes, stretching does make a difference. So I talked earlier about music and noise. So I would encourage you to think about if you get the facial movements right, it's a bit like all the players in an orchestra coming together at the right times to make a beautiful piece of music. So each muscle is a different member of the orchestra. And if they move at the right times, it makes a beautiful piece of music. But if all the muscles work together, if all the orchestra players play together, all you get is noise. Like when they're tuning up, it's just noise and it's not very pleasant. So the music I'm talking about here is getting the facial muscles to move in a precise and coordinated way. The noise would be the synkinetic movement, all the muscles all working at the same time. So we need to reduce the noise to get the beautiful music. So here's an example. I've talked to you about how lots of muscles can all be working at the same time. So you can see with this lady, she was trying to smile, and it looks like she might be weak on that right side of her face. That was what she thought. But actually, you can see all the red arrows are where she had extra movement going on. So if she had one muscle working on the left side of her face and 1, 2, 3, 4, 5, 6, 7, 8, 9 muscles working on the right side of her face, there's no way that the right side of her face was weak. It was overactive. So instead of working at a normal level, 100%, her face was working at about 120%, so way too much. So we worked with her to analyse what muscles were going on, which muscles were working when she was trying to smile, and we compared it to the unaffected side to work out which ones were the extra muscles, the noise, and therefore freezing her movement. So which muscles were in a sort of tug of war against the muscles she wanted to work. So you can see all the muscles pulling down on her face were pulling in the opposite direction to the smile muscle that just wanted to pull up. So they were freezing each other out. So she wasn't weak at all. Her movement was just blocked by far too many things going on. So the way we would treat that is we would treat people to suppress those movements. So everyone says to me, well, that can't be possible. But I'd encourage you to think about, if you've got children, if you've ever had to tell your children off when they've been naughty, but you actually think what they've done is really funny, I bet you've been able to suppress the laughter so that you can stay stern while you turn them off. That's suppressing movement. So we're all capable of it. And if you can suppress the movements that are going in the wrong directions, it will unfreeze the movement you want. So the correct movement for this lady, the smile, which has been there all along, will be revealed. So, like I've said before, the brain can't remember the address of all the facial muscles. So I like to describe the brain like a sat-nav that's been wiped when it's had a facial palsy. So you've got to reprogram in every single facial muscle into that sat-nav, and you've got to reprogram in every single facial expression into that sat-nav as well. So a nice way to do that is to really pay attention to the other side, think about what works when you do different expressions, and use that as your template for learning what you need to do on the affected side. You need to use small, really gentle, really graceful movements, because that's how the face moves normally. So you're going for precision and coordination, not strength. You don't want strength. And you need to do things slowly. When you learn anything for the first time, be it a musical instrument, how to speak a foreign language, you can't just become an expert in 5 minutes. You've got to take baby steps. So you've got to go slowly, give the brain a chance to learn these new skills, which are really tricky. And you've got to learn to suppress or zero the noisy synkinetic movements that are blocking the movement you want to do. We want music, not noise. And lots of people will say, oh, well, what I do is I look in the mirror and I try to get my face moving. And I would just say, don't do that. Go by the feel of your face, not by how it looks. And there's a reason for that. If I smile, you'll all be looking probably at the corner of my mouth. And the smile muscle is actually right up here in my cheek. So in terms of the face, that address is in a completely different county. So if you're looking at the mouth and your brain is focusing on the mouth, it's at completely the wrong address for smiling. Whereas if you go by the feel, you'll probably be able to feel that the smile muscle is in your cheek, and then you'll be closer to the right address. It's really difficult. I'm not going to lie, this is not easy to do. So you've got to be patient and you've got to be diligent. But if you work hard and you work with someone who knows what they're doing, you will improve. So let me show you that it does improve. So this lady came to me 22 years after she'd had her left-sided facial palsy. So her facial palsy was on the left side of her face, not the right side. And she thought that her facial muscles were weak and that was why she couldn't get her smile to go upwards. And she thought her smile was gone forever. So we taught her to find the address of her smile muscle and to zero or quieten down the muscles that were blocking her smile by pulling in the wrong directions. And this was her afterwards. And I just wanted to read you a quote from something she wrote to me. And she said, "Thank you for everything you've done for me. I never imagined my smile coming back. I thought I had lost it forever. Having my smile back has allowed me to feel happiness again for the first time in over 20 years. And that was just amazing to get that feedback, and I was so pleased that we were able to help her. So another lady, you'll recognise her picture from earlier, she came to me 5 years after her right-sided facial palsy. So her face was very painful, very tight, and she had quite severe synkinesis. And she thought that her lips were weak and that was why she couldn't get them to pucker forwards properly. What she didn't realise was her cheek was really tight and overactive, and that was freezing her face and stopping her lips moving inwards. So the cheek pulls outwards while the lips pull inwards. So if they're going together, they're pulling against each other and they're going to freeze each other. And her tight cheek was making her eyes small as well. If you have a go on yourself, on your unaffected side, if you've got facial palsy, if you just squeeze your cheek tight, you'll see it straight away that it makes your eyes smaller. So as soon as you relax the cheek, it's going to relax around the eye as well. So learning to zero or quieten down her cheek also helped quieten down the eye. And she had 6 sessions of specialist therapy with me over 2 years. And this was how she looked afterwards. She changed her hair colour as well, but she looked fantastic, and she still does. So how long do you need to spend in facial therapy? I mean, most people work with me from about 12 months up to about 3 years, I would say, depending on how severe their facial palsy is and depending on how easy they find to change things. But the change is quite slow because it's a nerve injury. It takes time for the brain to learn new things. If you were going to learn a musical instrument like the violin, which my daughter played, you're not going to go away, pick it up and be an expert immediately. It's going to take time to learn, and it takes time to learn how to move your face in the same way. So we tend to see people every month to start with, and then gradually we see them less frequently as they learn to become their own therapist for the longer term. So they learn all the skills they need to manage their facial palsy themselves. So I would say about 90% of the treatment is done at home. So I would teach it to my patients, and then they would do that at home. And remember, when your brain learns something new that's really important to it, it doesn't forget it. So you're going to maintain all these improvements. Once you've learned something and you think that's really important to me, that I've learned how to smile properly, your brain's not going to forget how to do that properly again. And it's never too late. You've seen that. You've seen the gentleman who was 11 years down the line, the lady who was 22 years down the line. They improved. So can anyone. Everyone can be helped in some way. And if you live in the UK, it's important to know you've got a choice on where you access your care. So make sure that you choose a specialist centre for your facial palsy care. And you have a right to that care, so don't take no for an answer. I wanted to talk a little bit about botulinum toxin as well, because that can be really useful for synkinesis. So this lady here, she had facial therapy and botulinum toxin for her synkinesis. So what we do is we inject it into key areas of the synkinesis, and that might be a doctor or a therapist that does the injections. And it works because it reduces these overactive muscles back down to a more normal level. So basically it quietens down the noisy muscles, and it allows you this window of opportunity to work on relearning really precise, coordinated movements the correct way, whilst the muscles that were opposing that movement are quieter for a few months. Sometimes if the other side is overactive, they might give some injections on there as well, but we tend to try and leave the unaffected side alone so that we can use it as our template for learning. We don't want to mess around with that template too much. And you shouldn't be having injections if you haven't had specialist facial therapy. The injections cannot reprogram your brain with the correct address of the muscles. They can't retrain your brain about how to move your face properly, and they can't train your brain about how to quieten down the synkinetic movements for long-term recovery. And it's certainly the injections can't stretch out the short, stiff, tight muscles. So injections are a tiny part of the process, but the biggest part of the process is the therapy. I had a few questions as well from people about congenital facial palsy. So this was the type of facial palsy you had from birth. And botulinum toxin injections can be used for this as well. So what we would tend to do in this case is inject the unaffected side and then do therapy for the affected side. And the reason for this is because we think sometimes when people are born, they have a nerve, but it's not working. The brain just never bothers to learn to use that side. It neglects it because it's easier to use the unaffected side and just roll with that. So we use treatment to help reduce that neglect, get the brain to recognise that side of the face can do something and learn to rebalance the face. So here's an example of a gentleman who came to us, two gentlemen actually. So they had injections on the unaffected side and therapy to try and strengthen up and find the muscles on the affected side. And you can see that they learned to find the address of the correct muscles and balance their smiles better after over 40 years of their face, of those muscles not working properly, which is amazing. They both did brilliantly. So if there's no nerve there, therapy is sadly not going to work because there's no nerve to get the signal from the brain down to the muscles. But for those patients, there are still things we can do with injections and surgery to help improve symmetry. So if you don't have a nerve, there is still help that we can give you. I can't talk about facial therapy without talking about psychological therapy because suffering a facial palsy is really traumatic. Anyone who's been through it, anyone who knows someone who's been through it will know how traumatic it was for them. And I think it's also important to know that how severe your facial palsy is doesn't predict how distressed you'll be. So I've had patients who have had extremely severe facial palsies, but really haven't been very distressed by it at all and are quite happy to just go about their life looking as they do. And I've had patients where their facial palsy has been really, really tiny, but it has absolutely wiped them out and they just can't function in any way at all. They are so distressed by it. And that's okay, that's normal. Severity, how severe your facial palsy is no indicator of how distressed you'll be by it. And that's why we screen all of our patients for psychological distress, and that's absolutely imperative. And every single patient, if they need it, should have access to psychological support, and that needs to be carried out by someone who knows about facial palsy, ideally someone in a specialist facial palsy service. At our service at Queen Victoria Hospital, we have a psychological therapist who works with us within our team with our patients. And there's so many treatments that can help with facial palsy. And it really supports what we're doing with our specialist facial therapy and complements the treatments. And children with facial palsy, they're going to need extra support and interventions on top of the ones adults need. So they might need extra support at school, for example, and there's lots of support available. And a lot of my patients will say to me that one of the most helpful things I've ever done for them is advise them to go to a support group where they can meet other people who have facial palsy and get that peer support from their fellow sufferers. So please access the support groups via Facial Palsy UK. They're available all around the UK, and at the moment they're all still running but online. So please access those, they're so valuable. So there are some surgeries that can help. There's a very small percentage of people who sadly don't recover at all from facial palsy or don't have any nerve at all. But these patients can have either a static operation where something's done to their face just to help the resting symmetry be better. So instead of dropping down, it's held up slightly. Or they can have more complicated operations where we try to give them some movement back. So we might try and give them back a small smile by taking a muscle from somewhere else in the body and implanting it into the face to create a smile. And we can also do surgery to put little tiny pieces of platinum into the eyelid to help improve the blink and eye closure. Amazing. So these are two of my patients who have had reconstructive surgery for their facial palsy because sadly they didn't recover at all. And you can see they really look great post-operatively, both smiling, made excellent recoveries, worked really hard with their facial therapy as well. With synkinesis, there is surgery that can be done to improve it. And the people who would tend to be appropriate for that surgery are people who've got really severe pain from their synkinesis or real cramping in their neck, for example, and that doesn't resolve when they try botulinum toxin and therapy. So if they've tried injections and they've tried specialist therapy and nothing's working, then they might be a candidate for this type of surgery. And this is when they expose the lower facial nerves in the face and they test them, and anything that's causing excessive movement in the neck and lower face gets cut. So mainly we want to reduce pain. It's possible that you might get an increase in movement, but that would be a secondary effect. And of course, there are risks with all surgery. So there is a small risk of excessive weakness after surgery. But these are two patients who've had this type of surgery, and I think you'll agree their smiles definitely look better after the surgery. They've certainly felt more comfortable, less pain, and they've both felt much more confident after having the surgery as well. So big successes for them. If you're going to have surgery, it absolutely has to be done by a specialist surgeon who specialises in facial palsy, and you have to have specialist facial therapy before and after your surgery. That's essential. Just want to talk a little bit about children with facial palsy. So if someone is born with facial palsy or they get it very early, then they're going to feel differently to someone who gets their facial palsy, who has their face working and then one day doesn't. So it's very different growing up with a facial palsy to having normal facial movement and then suddenly losing that movement later. So they're going to feel like that's their face. So you mustn't assume that they want to change it. I think I see a lot of parents who are understandably extremely anxious, but their children are bright and not worried about their face at all. They're loving life. So it's really important that we don't make any assumptions about kids and do anything. We don't want to rush into doing any invasive surgeries, for example, because I strongly believe that children should be involved in every decision about their care. So we shouldn't be rushing into something that they might resent later or you might regret later. And children should be seen by a specialist facial therapist who's qualified, but they should also have some paediatric knowledge as well. So that's important to ask, have they treated children before? And as your child gets older, the goals that they have will change and their understanding will change. So a specialist therapist will change their rehabilitation every time they see them to suit the age of them at that time. And children can have injections if necessary. They just have to be old enough to consent to that and to understand the benefits of it. So again, it would be about involving them in the decision making. I think the youngest children I've ever treated with injections, I think I had a very mature 8-year-old girl who wanted to have injections, and she did extremely well. She was braver than a lot of my adult patients. And there are loads of resources for children via Facial Palsy UK, so please do have a look at what they've got. They organise family days where children can meet other children like themselves. There's a beautiful book about facial palsy that you can read with your children, or they can take into school for other children to read, and loads of information for parents and information for different aged children all the way through to teenagers. And there's exciting developments coming up as well. So Improve FP is a new app for facial palsy rehabilitation, and it's been developed by a number of specialists in the field. And it's an app. It's going to help you with your facial rehabilitation once it's launched. It's going to help diagnose the stage of your facial palsy, so whether you're flaccid, whether you have paresis, or whether you have synkinesis. And it will give a specific recovery plan for that stage of your recovery. It will give appropriate advice and articles and videos to suit the stage of recovery that you're at. And it will also get you to fill out different questionnaires along the way so that you can track your symptoms and monitor the change and recovery in your face to see progress, because it can be really difficult to see the change in your face when you see your face every day. So having something that will track your symptoms and monitor that change is really, really valuable. And this app, I'm really excited about it, and it's launching later this year. So I would really encourage you to sign up to the Facial Palsy UK community to make sure that you get notified as soon as it's available. And the web address is there if you want to join the Facial Palsy community. So I'd really encourage you to do that. That's a very exciting development that's on the way. So just to give you some final thoughts, I talked earlier about what would it be like if you had a nerve injury in your legs and you were going to have to learn to stand up again, you're going to have to learn to coordinate your steps again, you're going to have to learn to walk again after being in a wheelchair. And I think it's really easy to think about this, and you would never think there was going to be a quick fix if it was your legs. You would know that it was going to take lots of focus, lots of concentration and lots of dedicated practice over a long period of time to relearn these movements. And you would expect, I think, that there was going to be times when you got frustrated along the way, but you would also probably try and be patient, try and persevere, and know that that would pay off in the long run. And a nerve injury to your face is no different at all. There is no quick fix. Each facial expression has to be relearned and re-coordinated. And again, it's going to take focus and concentration and dedicated practice over a long period of time to relearn all of these things. And there's definitely going to be times of frustration, without a doubt. But if you're patient and if you persevere, it will pay off and you will improve. So I just wanted to say, you are capable of anything you put your mind to, and nothing worth having ever comes easy. So thank you so much for tuning in to this Facebook Live. I really hope it's been useful for you. I hope that I've answered all the questions that people so kindly took the time to post before the talk. And I will take the time to go through any questions that have come up during the talk as well and try and get back to as many people as I can. But there's an email address there where you can contact the group that I'm a member of. I'm a chair of Facial Therapy Specialists International. So if you want to contact a specialist facial therapist, then please use that email or get in touch with Facial Palsy UK if you want to get in touch with me specifically. We're always happy to help as many people as we can, and we'll always try and be there to answer your questions for you. So thank you very much for joining me, and I will say good night to you all.